Welcome back. Doctors tell One America News they are being threatened and silenced for raising questions about the effectiveness of coronavirus vaccines. One America's Pearson Sharp sat down with Dr. Kirk Milhone, a pediatric heart specialist, who explains the vaccine represents a greater danger to our children's health than COVID itself.
The pandemic continues to take a massive toll on America, but it's not the Chinese virus that's doing the most damage. It's our leaders in Washington. The lockdowns and unscientific mandates have cost our nation more than we can possibly calculate. All for a virus you have a better than 99.997% chance of surviving without any lasting consequences. Despite that, our overlords have decided that we still need to take a so-called vaccine against the virus. One that doesn't prevent you from getting infected, it doesn't stop you from spreading the disease, and it's one that you have to take over and over again for it to be even slightly effective. On top of that, there are apparently significant and serious side effects of which we are only now learning of their lasting consequences, some of which include death. Doctors, using science, have tried to warn the public about these dangers, but they're denounced by the mainstream media and political elite, the same people insisting that we follow the science. Here now to discuss this with me is Dr. Kirk Milhone. Kirk, thanks for coming on the show.
Pleasure to be here.
So, briefly, tell us a little about your background and what you've seen as a doctor on the front lines of this viral outbreak.
So it's pretty interesting to be in my career at this point. I've been a board-certified pediatric cardiologist for 19 years. I've been a board-certified pediatrician for 20 years. I did my PhD before I went to get my medical doctorate, and that was in cardiovascular inflammation. So it's an interesting time for pediatrics to be discussing this vaccine in the pediatric population, where we're seeing something that we didn't expect. So you would expect in normal times to have about 0 to 4 cases of myocarditis in the time that we've been looking at this vaccine, for about 2 million doses in sort of like teenage age frame for children. Instead, we've seen well over 128. That sort of got our attention, and it's got our attention all throughout, not only the US, but throughout the world, that this is something that we're seeing over and over again, specifically after the second dose, shortly after the second dose of the Pfizer vaccine. We're seeing an inflammation in the heart, and many of these children are needing to be hospitalized.
Okay, so you kind of jumped into some of the questions I wanted to ask you. Specifically, as a physician who specializes in childcare, how has this virus been impacting children? I mean, everything that I've read up to this point is that children are largely immune to this disease, or they aren't seriously affected by it. Is that happening?
Well, yes, if you look at the total numbers, what is happening in science right now, people are talking in anecdotes. There's this person or this child or something like that. There was a very nice study that just came out of Turkey recently that showed was comparing flu and COVID vaccine, COVID disease in children who were hospitalized. So when they looked at how many children who had the flu went to the ICU versus how many children who had COVID went to the ICU, it was 19% for those who had the flu and only 3% who had COVID. If they looked at ventilators, how many children who were hospitalized went on to be on a ventilator, for influenza it was 16%, and for COVID it was 2%.
So it's really not that much of an issue. It really hasn't been impacting children as much as the media, for example, would say that it is.
Well, exactly. And my care of children, what I've seen is largely they have 2 or 3 days of maybe a fever, maybe even have less than that, then they get better. I've seen very, very few children who needed anything except basic supportive care for a viral illness.
Okay, so then do you think that all these mandates are necessary for our children? Do they need to be essentially quarantined at school with masks and dividers and treated like little biohazards?
Well, I think that's one of the difficulties how we've looked at this whole pandemic, is that we've sort of, the medical community or the public health community decided to treat sort of like one size fits all approach. And we usually don't do that. We usually try to risk stratify, and children, fortunately, unlike the flu, are actually very, very low risk. And so I think that in other diseases, sort of like respiratory syncytial virus that I'm very familiar with because it has a pretty harmful effect on children who have heart defects, we stratify our treatment based on risks. And so we don't treat everyone the same way. And I think we should be looking at children the same way. They're not adults and they're not the elderly. They're not just typically the people who have really high risk for being hospitalized, being on ventilators in the ICU, or dying from COVID. But we're treating them just like everyone else, and it seems
we're not making any distinctions.
no distinctions, which is strange for us in science.
So the big question then is that Fauci and this government are pushing hard for children to get this experimental injection. I won't call it a vaccine because it doesn't fit the definition. Do you think that's necessary? Should children as young as 5 years old be getting injected with this drug?
You know, I appreciate what Martin Kulderoff, an epidemiologist from Harvard, said. He said, I don't think any children need this vaccine. And I think that we have good data to support that. I think we should also watch very closely for the kids who we know are more likely, who have comorbid or other diseases that are going on, that we need to watch them closely and treat them early and be very careful with them. But to say that we're going to vaccinate everyone seems unmerited by the data.
If they don't need to take this drug, why are politicians pushing so hard for our children to get injected?
Yeah, that's a very good question.
There's no answer?
I don't have a good answer for that. Like I said, as I look at this, how we've treated other things, we don't mandate vaccines for the flu. The flu vaccine is pretty leaky. We know from the recent data out of the Lancet that this vaccine is pretty leaky, especially against Delta. That whether you're vaccinated or unvaccinated, you still have a risk to carry similar levels of virus and spread them to vaccinated and unvaccinated people. So it's not like if we vaccinate everybody that we don't have to worry about spread.
So if 100% of people were vaccinated, it still wouldn't get rid of the coronavirus?
It doesn't appear so from all the data that we're seeing right now.
Okay. Talk a little bit more about the side effects that you've seen with this drug so far. I mean, what kind of effect is this injection having on children?
Well, we're at the very early stages of that because of how it's been rolled out, and so my biggest concern is the idea of myocarditis, which is an inflammation of the heart. That's what it means. Myocarditis is sort of like the muscle of the heart, and when it gets inflamed. How we see that is some kids might tell you that they have symptoms. When they might be short of breath, they might be very, very tired, it seems out of normal, and then they're taken in and evaluated. They might get a blood test that suggests their myocytes in their heart are damaged and are releasing a chemical called troponin. And then we might do an echocardiogram to look at how the heart actually functions and see the function is down. And these are typically very, very healthy kids. These are seen in the athletes. And their risk of coronavirus is very low because the athletes usually have no comorbidities or they wouldn't be athletes.
So would you say that is it fair to say that these healthy children who are getting injected and then have these symptoms, just myocarditis, is it fair to attribute that to the vaccine?
Well, I think that we're seeing that very clearly. I think even Pfizer, as they looked at this, they knew this was a concern, and they said
it went ahead anyway.
They said in their thing, we haven't powered our study on children to look at this. We know we didn't do enough studies. The study from the group out of Boston that was recently published in JAMA Cardiology said, we actually know that this is directly related to the vaccine, and we're going to need to study this a lot longer, over a longer period of time, before we can make any specific recommendations. Now, that doesn't sound like something like in my state of Hawaii. They're mandating all high schoolers be vaccinated in order to play sports. That's going well down below the line for any of the approvals.
So that goes into my next question, because what really surprises me about all of this is the apparent stubbornness in ordering people to get injected. I mean, despite the clear warning signs. And for example, the Mayo Clinic just came out with a new study and said there are significantly higher rates of cerebral venous sinus thrombosis, or blood clots in the brain, after the Johnson & Johnson vaccine. In fact, they said you're 3.5 times more likely to get a blood clot in your brain if you take the vaccine. But then the conclusion of the study was that the higher rate of this rare adverse effect must be considered in the context of the effectiveness of the vaccine in preventing COVID-19. So basically, yeah, you've got a much higher chance of getting a fatal blood clot in your brain, but go ahead and get the vaccine anyway. I can't understand that. Why are they pushing this drug so hard when they know it could be dangerous?
I'm not sure, because often what is said as a narrative is not what I'm seeing scientifically. If I look at the healthy children and I look at their risk of myocarditis versus the risk of a healthy child being hospitalized, it's at least a 2 times greater risk to be hospitalized from the COVID vaccine than from COVID itself. So I hear a narrative, but when we try to bring up evidence, it seems to be ignored.
So when people are, or when the science says that, you know, there may be rare side effects, but it's still worth the risk. You don't agree with that?
Well, I don't think it's me agreeing with it or not. There's a nice paper, a preprint by Dr. Hogue at UC Davis, who was showing this very clearly, that the risk for a healthy child is higher with the vaccine than with getting COVID.
Okay. So what do parents need to know about this? Parents who are concerned, you know, a parent who might be watching this, who's on the fence about letting their child get injected. Maybe they're worried they won't be able to send their kid to school if they don't get the injection.
Yeah.
What would you say to them right now? What should they know?
Well, they should ask the questions. They should ask the questions. What are the risks? For any procedure, anything we give, we should be able to honestly tell a family member, a parent,
Informed consent.
informed consent. What are the risks? What are the benefits? And what are the alternatives? That's what they should be asking for. But that's often not happening. Not in drive-by vaccine opportunities.
Right.
This is a very nuanced discussion. I mean, you have to look at, okay, this child in front of me, what are their risks? What comorbidities do they have? Is this a child with diabetes? Is this a child with childhood cancer?
And they're not doing it.
Is this a child that we need to really watch closely? Or is this like, wow, this is an athlete?
Mm-hmm. Yeah, exactly. The other thing that's kind of concerning is they're also promoting this heavily for pregnant women. Do you think that's a good idea? Should pregnant women be getting injected with this drug that's been on the market for less than a year?
Well, this goes back to the when we start mandating things for illnesses we have not studied and interventions that we have not studied for a long period of time. I think reproductivity, you have to study that for a long time. We have to see what it does pre-pregnancy, during pregnancy, and after pregnancy. That's why vaccines take a long time to usually get out, because we want to study them for a long time. If we try to rush things out, we often make mistakes that aren't easily repaired.
Or ever repaired?
Ever repaired.
There are reports that it has been causing miscarriages in a significant number of women. Would you say that's fair to attribute that to the vaccine, or is, again, we still don't know?
Yeah, there's a lot of people are very concerned about an article that came out in JAMA regarding, or the New England Journal of Medicine regarding this very issue. So I think this is actually, we need to have an honest look at the data and be able to evaluate it and give people a clear risk. Right now, remember, we're still under emergency use authorization for many of these vaccines. And we're sort of using all three, sort of saying that this, the approval by FDA for one sort of applies to all three.
And that's the next thing I wanted to ask you, because the big laurel in the wreath of this vaccine is that now it's FDA approved. Do you think that's reason enough to trust it? Is that stamp of approval enough to dismiss all our concerns and just go ahead and line up for an injection?
Well, remember, that's just for the new Pfizer vaccine, 16 and above.
Right.
But it's using sort of push, well, you can get the Moderna or you can get the J&J. Remember, the Moderna has really 3 times as much as RNA as the Pfizer does. And other countries around the world have paused that vaccine for young children and people under 30. So there are other people who are looking at this and saying, you know what, maybe we should slow down a little bit, especially when we have early treatment options. We can help people. We not only have medications that have been shown through multiple studies to be effective, we also have monoclonal antibodies that we can use, and we can dramatically decrease the risk of hospitalization and death with early treatment. But it seems like anything we come up to say that is against the vaccine in any way, we're called anti-science and flat earthers. I've got an MD and a PhD. I'm not a flat earther. I'm just actually like to look at the data.
Right, but Anderson Cooper obviously knows a lot more about this than you do. You know, he's much more qualified to talk about it than you are.
Yeah, it's interesting. I'm not sure why it's so hard to have just a pure scientific debate about this.
That's one of the most frightening things is that any talk about this that's not sanctioned by Fauci is completely covered up and dismissed.
But we're being warned. We're being warned very clearly if you speak out against the vaccine in any way. And I'm not speaking out the vaccine. I'm just looking.
You're
at
just
the
talking
data.
about the science.
Right? I'm just talking about the data as I would about any other intervention I use on a child. Can we talk about that? But my license is being threatened. My board certifications are being threatened. I've gotten emails from both the licensing and the board certification saying if you say anything that is against this, we're going to consider that we could consider it unethical and remove your certifications and your license.
Which is outrageous because I think as a doctor, one of your primary responsibilities is to look at all angles of any drug or treatment or anything that you have to give to your patients. You have to be sure as a doctor that this is safe, and they're not letting you do that.
Remember, it's much different to do something to someone than not do something. Right? If I do something, really the credo that we have, that I would hope that we still have, is first do no harm. If I give you, let's say, and this is my concern about the vaccine, let's say I'm vaccinating, we're vaccinating the entire population of children, try to prevent those who would have comorbidities and have an increased risk. But if I give a healthy child a vaccine, I know what the known risk is for them getting myocarditis. If I don't give them that vaccine, I don't know what the risk is because they may not get COVID. They might have such mild COVID we didn't even know they had it. They might have a mild viral illness they get better from. But I'm exchanging a known risk if I give them the vaccine as opposed to allowing the parents, like we've always done before, to choose.
I think the worst part of all of this is that most people probably feel helpless, like there's nothing they can do. Their backs are up against the wall with this and these mandates. What options do people have? What can they do if they're concerned about this, short of moving to a state without vaccine mandates?
Oh boy. This is what we're struggling with, and that's what I'm seeing. We're seeing populations move. It's a big issue in my state. And I think that's very difficult. I think we have to have our voices. I think people need to go to school boards and we have to have discussions there. We have to have discussions with physicians. We have to sort of call for, can we have town halls where we have debates? We never have a single narrative in medicine. There's always a debate. I mean, no matter what we're doing, whether we're how we treat menopausal women, there's a debate. How we treat children with heart defects, there's a debate whether we do it. Are we going to do it through the leg or are we going to do it through the chest? There are all these debates. This is healthy for medicine to have debates.
Yeah, but haven't you heard that the science has been settled on this?
Oh my gosh, yes. I hear that all the time because when I try to bring it up, they call me they basically go straight to ad hominem attacks.
Yeah.
Why can't we just discuss the science?
Well, the science has been settled. You need a booster shot every 7 months. No, every 6 months. No, 5 months. 4 months. Every 2 months, you need a booster shot. But the science, it's settled.
Yeah, so, the problem with that is it gets beat up by an angry gang of facts. Because, I think all of us know, for those of us and those people who were infected with what I'll call legacy COVID before all the different variants started coming, I've watched these people because in my community, it's a small community, and we had a large pantry that we were serving thousands of people. And so after 3 months, during the heart of the COVID infection, during the late winter, early spring of 2020, I tested 125 of our volunteers to look to see who had COVID. And I saw 7 that had COVID. I know who they were. I've watched them as Delta came through. None of those got reinfected. 3/4 of the people who were fully vaccinated in that group got reinfected, but got infected with Delta.
Well,
but that is being seen. There are over 100 papers now that show lasting immunity, durable, good immunity with a previous infection.
Well, there was that big study out of Israel that was something over 500,000 people were studied, and it found that you have lasting immunity, natural immunity, for over a year whereas it's, it wanes after 6 months or less with the vaccine.
Yeah, that's the data.
Would you say, ignoring all of the political talk about it, just from a strictly medical standpoint, would you say that the vaccine is effective at doing what they tell us it is intended to do?
I think that constantly keeps changing, and depending on as we go through this, I hear different terms of what it's supposed to be doing.
Right.
See, I think we have to look at it from public health. What do people expect from a vaccine? If you have tetanus, you don't expect to get tetanus. If you have polio vaccine, you don't expect to get polio. If you had a measles vaccine, you don't expect to get measles. And so regardless of what people say, if they get a vaccine, they expect not to get it. And so they act like they're not going to get it. And so when they get a headache, a sore throat, a cough, a runny nose, sinus pressure, a fever, they go, well, I've been vaccinated. This can't be COVID. And so I understand that from a public health standpoint, because in the past, anytime we gave someone a vaccine except for the flu vaccine, people thought they didn't have to worry about things anymore. And so remember that after people were fully vaccinated, we let them go indoors without masks. And then what happened? We saw that people who were fully vaccinated were getting infected again. That came out of Barnstable, Massachusetts. And so the CDC said, oh my gosh, we got to put people back on masks. Why? Because they found that their vaccine was not effective in preventing infection.
Right. Would you go as far as saying that this vaccine is dangerous?
Well, it depends on the population, right? That's why it's not a one size fits all. You have to look at what are you asking me about? What is I can tell you what the risks are, and then you have to decide. I like people to be able to decide. They're putting it in their body. That's not my choice. It should be their choice. Because every person has a different risk stratification. So there are probably some you could say, wow, I could probably use it in that. At this time, we might look down the road and go, boy, yeah, we're never going to use that vaccine again. Or there might be a subpopulation we go, yeah, it's not the one we like for everybody because of the otherwise healthy children who are getting myocarditis. So we're not going to use it in them, but we might have this subset we use it in. That just requires us to look and be honest. But right now I'm concerned that we're not even really being willing to discuss that. All the papers I read, when they bring up the issues of myocarditis, there's always a disclaimer saying, but we still think you should get vaccinated.
Right.
That's a public health paper.
Exactly.
Why are we injecting the public health into just a description of what we're seeing as physicians and scientists?
So at this point, could we just dismiss all the mandates and all the requirements we have for children and just let children run around and live life normally as they did pre-pandemic?
I think that was one of the ideas of the the Great Barrington Declaration was the idea is that these are the lowest risk patients. Why are we putting them under some of the harshest restrictions? We could watch them closely, and as I know this was very controversial, but we're not like throwing them into the fire. We're saying, you know what, they actually go through this very well. They have a very low risk of hospitalization. It's 0.0001%. It's very low. And so they can build the herd immunity, real lasting herd immunity. So yes, I'm not in favor of mandates in children, especially because they're not my children. They're someone else's child.
Right.
I don't get to tell them what their child should do. I should explain, as a physician, this is what I can offer you. This is the risks, the best I know. These are the benefits, as best I know.
But parents don't know what's best for their children.
Well, I don't know. I would want to be able to make those choices for my son.
Naturally. Okay. Is there anything else that you think people should know about this? Anything that the American people should know about what's going on with this, or concerns that they have, or anything else you want to address?
I think anytime stuff is censored, be very concerned.
Yeah.
So the fact that there are voices who are being censored in medicine, that's very concerning. I think that since there are threats to people who are really just looking out, trying to do their best for their patients, and they're being threatened with losing their license for having a different opinion, that should be very concerning to people.
What you're doing is literally science. You are a doctor, and when you are looking at this medicine and how you treat your patients, I mean, you're literally doing science, and they're trying to stop you from doing that. So they are literally covering up science to prevent this.
Yeah, that's what's hard for me to understand.
Okay. Dr. Kirk Milhoan, thanks for coming on. I really appreciate your time.
It was a pleasure. Thank you for having me.